So CBD and THC are two very common cannabinoids that are typically found in the cannabis plant.
Now, whether or not it's addictive, that's quite a loaded question.
People need to understand that the route of delivery is very important when it comes to THC specifically.
From the Zoomerplex in historic Liberty Village, the Zoomer with Marissa Lennox.
Welcome to the Zoomer. I'm Marissa Lennox. For the past 20 years, many Canadians, especially Zoomers, have turned to medical cannabis to support their health needs. But some of us still have questions about its role in healthcare. On today's program, we'll answer viewer questions about strains, potency, how to consume it, and for what conditions. But before we dive in, let's tee up the topic.
The stigma of smoking pot is fading, and people are consuming it more than ever before, especially Zoomers. Individuals 45 plus are the fastest growing group of cannabis users today. More than 1 in 4 are new to it. Meanwhile, usage among this demo has jumped tenfold since 2012. 40% of consumers today use it for medicinal purposes, including therapy, pain relief, and sleep aids. Meanwhile, more than 40% of older opioid users saw a mild to significant drop in their use of opioids. Further evidence that cannabis can be a bona fide treatment alternative for pain.
Joining me now is Dr. Stephen Glazer, internal medicine physician and chief medical officer at Canaway Cannabis Clinic, and Omar Syed, president of Optican, the medical division of Heritage Cannabis. Great to see you both. Let's get to it. The first question comes from Steve.
Hi, my name's Stephen from Toronto, and my question is, what's the difference between THC and CBD, and what is the entourage effect?
Omar, I'll start with you on that one.
Okay, well, that's a good question. I think it's a fairly common one. So CBD and THC are two very common cannabinoids that are typically found in the cannabis plant. THC is the one that most people associate with a high. It causes euphoria and can have some analgesic effects as well. CBD is the one that seems to be more associated more with the medical effects for many people. CBD is an anti-inflammatory. It can help in conditions such as seizures in children. It's been approved for that as a drug called Epidiolex in the U.S. And can be used in specific conditions such as anxiety as well. So they're very different in terms of their pharmacology, but because THC and CBD interact in some ways in terms of the cannabinoid receptor system in the body, they can be synergistic along with other cannabinoids that are in the plant as well. They're up to 80 in the cannabis plant that have been identified. So the entourage effect typically is the fact that you find some synergy between the cannabinoids and terpenes that are in the cannabis plant to increase and maximize some of the benefit that people feel by using cannabis.
All right, and the next question comes from Robert. He writes, how long can low-dose combo of CBD and THC be used to aid sleep? And I know we have a lot of questions on sleep today. Dr. Glazer?
Well, let me just first off explain a little bit about sleep. So based on the two components that we clinically use, they have actually both different and similar effects. So let's break that down, CBD first of all. So CBD at low doses actually can be stimulating. And so if you are taking CBD at lower dose and have a sleeping problem, it may be a clue as to why that's happening. At higher dose, however, CBD is sedating. THC, on the other hand, is sedating and can be used in the use of sleep disorders. So often we actually use them synergistically or together, and there is no time limit on how long one can use these preparations.
All right. Okay, and Omar, do you have anything to add there?
Just one other thing that I think Stephen didn't mention, but there's another component called CBN, which is quite sedating, and it's available in some of the plants out there. It's a breakdown molecule within cannabis. And CBN can cause a fair bit more sedation. So people are looking for specific remedies for sleep, CBN may be something that may be more helpful.
All right, interesting. Okay, the next is a question from Donalda. Go ahead.
Hi, my name is Donalda McIsaac. I'm 66 years old and I'm from Nova Scotia's C.A.R.P chapter. I was wondering, has COVID affected the cannabis use? Because it seems like alcohol consumption has increased. Have you noticed the same thing with cannabis consumption?
Omar?
So I'm not going to comment specifically to recreational versus medical, but I can comment specifically to recreational. Cannabis use on the recreational channel in terms of use legally has been going up in Canada steadily since the legalization in 2018. And I can't really say whether or not that rate has increased much in the last couple of years since we've had COVID. So I can't really comment on the medical side. I'm not sure whether or not there's been a major change. And Stephen, maybe you can address that.
So thank you for that question, because I think that now more than ever, having experienced this pandemic, it has had several consequences leading to people having mood disorders, isolation, financial things. So it certainly has impacted on the ability of people to get a medicinal cannabis. Again, I'm not going to speak about the recreational. A lot of the research that has been done on the use of cannabis for the most part has been in the early phases of COVID. And some of the preliminary data that has been elucidated is that by and large, the use of cannabis may have been slightly increased, but has been significantly increased in those that are already users. So that's an important thing, because that puts, it provides greater concern. That's the first thing. The second thing is maybe some generalized data. I wear other hats, including specialists in obesity. And myself and Dr. Michael Vallis have done a national survey of the effects of COVID on people living with obesity. And in that survey, we actually asked questions about substance use. And we found that for people living with obesity, there was about a 6% increase in alcohol intake, 4% increase in smoking, and about a 4% increase in cannabis use. So that's evidence-based of what was happening at the beginning. In Canaway, our clinic, we are actually also doing a national survey of what the effect of COVID has been on people participating in a medical cannabis program. So that study is ongoing, and it actually will be a truer reflection of the effect of COVID-19. And we're very excited for those results when they're available.
Can you give any preliminary insights into that?
No, actually, I can't, because we're actually data collecting across Canada now. So I won't have access to the data until that time.
All right, well, we'll wait for that. It'll be interesting, I'm sure. Quick break. We'll be right back with more of your questions.
Medical cannabis is safer and can be very effective in weaning patients from opioids.
Welcome back to the program. We asked what you, our viewers, want to know when it comes to medical cannabis and invited experts in the industry to answer. So let's jump back in. Ruby has the next question. Go ahead, Ruby.
My name is Ruby. I'm from Brantford and I'm 64. Has cannabis been effective in weaning people off opiates and other addictive medications, specifically in case of anxiety and pain? Is cannabis addictive?
Dr. Glazer, sort of a two-part question there, but I'll start with you.
So the question was, what's the role of cannabis in the milieu of opioids? So there's no question that that cannabis has been very effective in helping not only minimize the dose of people who are on opioids, but being effective in weaning them off in many, but not all cases. When we look at people that are using cannabis and opioids, there is a 30 to 60% reduction in opioid use when we're used in conjunction, and 9.5 decrease in the dosage of codeine as well. So there really is a significant role. Medical cannabis is safer, better tolerated, and can be very effective in weaning patients from opioids. Now, whether or not it's addictive, that's quite a loaded question. So The first thing is that you have to define addiction, and that would be a syndrome when you stop taking cannabis, you have both either physiologic or psychologic symptoms. So for some people, it can be addictive, and it's well known, especially if individuals have started cannabis at a younger age. The WHO has not declared CBD as addictive, but THC, because it's associated with the euphoria and may be classically conditioned with other issues, can result in being addictive. The good thing is that, as was mentioned in your introduction, that many people are starting to use medical cannabis at a much later age. And so that potential for addiction, I think, is less. Omar, I don't know if you have any comments?
The person asked about anxiety, and I think CBD plays a very important role for many people in controlling anxiety. THC can be a bit of a toss-up, can get exacerbated and make it worse for many patients, but CBD specifically is a fairly useful ingredient for controlling anxiety. At Optican, we have a number of products that focus on that, including a sublingual film strip for rapid-acting relief of anxiety, and that's about it. That's all I have.
When people come for a medical assessment, it's very important to explore the etiology of anxiety. And I think that you have to sort of declare your course of management. So cannabis is very good in the symptomatic relief of anxiety, but I really do urge our patients to explore the underlying issues that if we don't really understand what is at the root of the anxiety, Band-Aid solutions is really not doing it complete justice. And so I'm sorry I interrupted, but I really want to make that point that that cannabis is not a treatment of anxiety. It's a symptomatic treatment. And it's always very important to try to understand the basis of it and try to deal with that.
All right, Ruby has a follow-up question. Let's play that. Go ahead.
How effective is cannabis for chronic pain management? Say if pain is at 10 at the scale of 1 to 10. Is it better than opiates in that case? Does it cause depression? Thank you.
Omar, go ahead.
With regards to pain, there's many different sources of pain. And I think when it comes to inflammatory pain, which is the source of pain for many patients with arthritis and other chronic conditions, CBD, again, is a very effective anti-inflammatory and can bring down the inflammation, which is typically causing much of the pain. THC, on the other hand, can play an important role in controlling nerve pain or pain associated with called neuropathic pain. And those are kind of in combination, both products can be useful for controlling chronic pain.
As a cause of depression, the short answer is no. Some studies have been done in the role of cannabis with depression, and there was some improvement or elevation in mood. But again, I go back to that issue of trying to understand and try to treat depression in the conventional way. On top of that, there's bipolar mood disorders where THC can exacerbate manic episodes, but CBD actually has had some improvement in the mania scores. And it was mentioned, I think, earlier as well, post-traumatic stress disorder, a very helpful adjunct of treatment.
All right, and Stephen has a question. Go ahead, Stephen.
Hi, my name is Stephen. I'm 24 from Vaughan, Ontario. And my question is there widespread acceptance of medical cannabis treatments in the medical community?
Dr. Glazer, your thoughts?
Great question. Very, very loaded. So I think that one thing is clear, that with the legalization of cannabis, I think we have been forced to embrace cannabis. I think it's been, for those that are in the field, I think it's been very helpful for us because it has obviously legalized it. But I think that one thing that we've learned is that as we do more and more research into this field, and we can understand the actual true science of cannabinoid medicine, it really provides a significant legitimization to this area. Nonetheless, I will be honest and say that there is still a stigma independent in the medical field, all over. So there is a stigma. I think it's quite unfortunate. And I think that the duty of those that are in the field are multiple. One of them is to educate. And I think that the more healthcare professionals are educated, then the more they will be accepting of this modality. The question was asked a little while ago about pain. Well, actually, in the last 40 years, there'd be no real great advances in the treatment of pain until medical cannabis. So I think that we're going to try to move this field forward. The other area is research. The more we do research, we dedicate research money to this field, there'll be greater acceptance. But also the patient has to self-advocate. Don't be afraid. Bring it to your physician.
All right, stick around. We'll be right back.
Many physicians are hesitant to recommend a product that has to be inhaled, vapor, smoked, etc.
Welcome back. We asked viewers to submit their questions about the safety and proper use of medical cannabis and decided to put those questions to leading experts in the industry. The next from Steve via email. Here's what he writes. Is it safe to take oral or topical cannabis if you have chronic kidney disease? Dr. Glazer.
So that's an interesting question. So with respect to oral, one has to be careful at extremes of kidney dysfunction, but topical is fairly safe because the absorption systemically is low.
Steve has a follow-up question. Here's what he writes. How soon must you stop using cannabis? If you travel to countries where cannabis is illegal, how long can it still be detected in your system? Now, I don't know that anyone's necessarily testing you at the border, but Omar, can you speak to that one?
I think it's pretty straightforward. I mean, THC and CBD, but THC more so because it's so fat soluble. If you're a heavy user and are being tested for it, blood level wise, you can detect it up to 3 months out from the ingestion of THC. CBD likely as well, but it's less. It's a little bit less prominent in fat cells. So, you know, up to 3 months is the general guideline if you're being tested.
Okay. Next question comes from Ramona. Go ahead, Ramona.
Hello, my name is Ramona Captain and I live in Surrey, British Columbia. I'm 70 plus years of age. My question today is, can cannabis be used to treat cancer?
Yeah, thank you for that question. So there's a couple of things. First of all, the mainstay of treatment for cancer, directly as treatment, is still really in the infancy. There have been studies that have looked with animal models in pancreatic cancer, in lung cancer. Some of the results are quite promising in melanoma as well. So I think that, you know, I must admit, I think that we're not there yet, but there is active research in the actual treatment. But what is important to mention is that there are very helpful uses of cannabis in patients undergoing treatment. And let me tell you what those are. So for chronic pain, so we've treated many patients that have metastatic carcinoma, and we have effectively treated their pain very well. That's the first thing. Nausea, very common side effect of some of the chemotherapeutic agents, and cannabis is also very helpful for that. Individuals are suffering from the anxiety of the trauma of being diagnosed and treated with for cancer. It's very helpful for sleep as well. So pain, nausea, and the last thing I was going to say, appetite. Many individuals lose their appetite. We actually learned about this with HIV and the wasting syndrome, that we found that we could help their wasting disease with HIV using cannabis. So also a role.
All right, Elizabeth has the next question via email. Here's what she writes. To what degree and in what way is cannabis helpful in the treatment of osteo and rheumatoid arthritis? Where can one be medically assessed for treatment with cannabis and obtain sound information and prescription for medical cannabis? My medical practitioner was not knowledgeable enough to provide me with information to prescribe it, advised me against using it as she didn't know how it would impact various aspects of my health. Goes a little bit back to what you were saying earlier, Dr. Glazer. Some practitioners aren't there yet in terms of prescribing with the knowledge, but your reaction to this question?
So first of all, there are two medical conditions you said, osteoarthritis and rheumatoid arthritis. So just to make sure that we understand that osteoarthritis is the garden variety of, bone-on-bone arthritis. And for that, actually, medical cannabis can be very, very helpful. Rheumatoid arthritis is a chronic inflammatory disease, and there may be a role, but again, it may be in the attenuation of pain. Whether it's a disease remittive medication, it really is yet to be seen. I don't think it's being advocated by the Rheumatologic Society as a treatment, maybe as a synergistic treatment. The other thing is that I am impressed by the candidacy of your physician who said that they didn't have good knowledge. And I think that therein lies the role of a medical cannabis clinic. So you asked the question, how could you find out? And my recommendation would be seek out a medical cannabis clinic. I recommend that you involve your physician to be part of that team, but get treated by experts, because we found in Canaway, our average patient is over 50 years old. And an individual at 50 years old is likely to have other comorbidities. And there can be synergistic or contraindicated effects of cannabis that you need to know about that may cause side effects that may be due to the cannabis or due to your other medications. So I urge you to seek a medical cannabis venue wherever you are and involve your family doctor.
Omar, is there anything else you'd like to add to that one?
Yeah, I think it's related to both the pain question and physicians' acceptance. So one of the issues I think is many physicians are hesitant to recommend a product that has to be inhaled, vapor, smoked, etc. And that is one of the biggest issues with the stigma associated with medical cannabis. At Optican, what we do is try to increase the effectiveness of other forms, such as oral or sublingual topical. And we test the products for that specific reason, because we know that some people, when they go from inhaled cannabis to an oral product, don't find it as effective. So having good data on products that are not inhaled, that we have at Optican, for example, and having that data available for physicians to be able to understand how they work and what the dosage is extremely important and part of that education gap that Dr. Glazer is talking about.
Good points all around. All right, we'll be right back with more on the other side of this break.
At high doses of CBD, it can be sedating. At lower doses of CBD, it can be stimulating. So you have to hit it right for insomnia.
Welcome back. On today's show, we put your questions and concerns about cannabis to leading experts. Let's get to the next one. It's from Marlene. Here's what she writes. How would CBD work on myalgia pain? Dr. Glazer.
Myalgia or fibromyalgia, I guess, is what's being asked here, is a chronic pain syndrome. But the etiology of the chronic pain syndrome has to be understood. So for symptomatic relief of the pain, it may or may not be helpful. My experience, some people are very responsive to medical cannabis for fibromyalgia and a very bona fide indication. And some people actually aren't. So it's a trial and error sort of thing. I will also say that part of the etiology of fibromyalgia are sleep disorders. And so if one were to improve the quality of sleep with or without the use of medical cannabis, that may actually translate to improvement of fibromyalgia. So it wasn't exactly the question, but it was related.
Very related and interesting. All right, the next is from Barbara. Here's what she writes. Is CBD oil effective for anxiety and inability to switch my mind off at bedtime? I have to say I know quite a few people who use CBD for sleep. Omar, what say you?
Yeah, I think there's good scientific rationale and some clinical evidence to support the use of CBD for treatment of anxiety. Many people have trouble sleeping because of anxiety and shutting their mind off, and CBD can be quite effective. And actually CBDA, which is the acid form naturally available in the plant, it can even be more potentially effective because it works better at the serotonin receptor. We have that in one of our products as well at optican.ca. You can check that out. But I definitely believe that there is a role of CBD for anxiety.
What is it that happens that causes your mind to shut off? What is the what's going on in your brain? I'm curious.
Well, first of all, the issue is CBD or THC. So THC also has been very effective in helping people with falling asleep, shutting off the mind. Medical cannabis affects several areas within the brain. There are receptors within the brain in all areas. One of the important areas are the limbic system, which is involved in a lot of the emotional aspects, the frontal lobe as well. And by stimulating certain receptors within the brain, you may have a calming effect. So it's not that you're shutting off your brain, you're just sort of calming down some of the activity within these emotional centers within your body. You know, those are the issues per se.
All right, another sleep-related question comes from Mary. Here's what she writes. Does THC help with insomnia, or is CBD better? Do either of them interact with glaucoma? Dr. Glazer?
Well, I love that question because it allows to comment on a couple of things. So, as I mentioned earlier, you need to understand that it's dose dependent with CBD. So, at high doses of CBD, it can be sedating. At lower doses of CBD, it can be stimulating. So, you have to hit it right for insomnia. THC does work for insomnia, but I want to take a step back and make a difference or make a distinction between insomnia. Insomnias are two types. There's initiation insomnia, which means my inability to fall asleep, and there's maintenance insomnia. I can fall asleep, but I can't stay asleep. And so this highlights the expertise. So as Omar was saying earlier, inhalation. So if someone was having problems falling asleep, they could very well vape a product which would act quickly and would help with the initiation insomnia. And that would probably be a THC or a combination of CBD and THC. However, if they were having maintenance insomnia, that they are having problems, waking up at 4 o'clock, 5 o'clock, 6 o'clock in the morning, then vaping would not be effective. And in that case, you would need an oral preparation, an oil or a capsule, where the effect is more spread out throughout the entire night.
Omar, do you have anything to add to that?
Yeah, I think one of the things that Stephen's pointing out indirectly as well is oral THC is very different than inhaled THC. It forms a different metabolite. It lasts a lot longer, and it can be disruptive to some people, but actually it can be quite useful for sleep, and it causes more drowsiness. Whereas inhaled THC has more of a stimulating euphoric effect. And I think people need to understand that the route of delivery is very important when it comes to THC specifically.
Elaine has the next question. Go ahead, Elaine.
Hi, my name is Elaine. I'm from Abbotsford, BC. I have a question about CBD. How much can you take it for pain? Is there a limit?
I'll get you both to answer, but Omar, start with you.
Yeah, for the most part, the studies that have been done with THC and CBD have been in combination. CBD is relatively safe. It's got a pretty wide therapeutic window in terms of efficacy. Again, most times when you're taking oral CBD, it's not very well absorbed. Be careful of the product you're taking. Products such as ours have better absorption, so you can take less of it. But for the most part, there isn't an upper limit. But it can become toxic in terms of some effects on your liver if the doses are taken too high for too long a period of time. For the most part, for our product, we say 25 milligrams once or twice a day is usually the effective dose for many patients, but depends very much patient to patient. That translates into about 100 milligrams or up to twice a day for the other unformulated products that are given orally. But again, I think it comes down to what working best for you in terms of CBD dose. But I would not go out to doses much beyond the 200 milligram range. And Stephen, you may have a comment on that.
Yeah, so I'll just accentuate some of your comments. That first of all, as the dose becomes higher and higher, one needs to be cognizant of drug interactions. So just keep that in mind, that the higher the dose, the greater the potential for drug interactions. That's one thing. The other thing is that it goes back to the way people handle or metabolize cannabis. Certain fast metabolizers may need more of a medication than slow metabolizers. The last point I would make is that there are certain circumstances where we have used whopping doses of cannabis with childhood epilepsy, where the doses has been as high as 20 milligrams per kilogram, which is a very, very high doses. But this is in a specific subset of patients. Those are children that have very difficult cases of epilepsy.
Interesting. All right, there's more after the break. Don't go away.
Topical CBD in the right formulation that has actual dermal penetration can be effective in treating local pain.
Welcome back. Viewers right across the country sent in their concerns and questions about medical cannabis, and today we're hoping to get to as many as possible. So the next one comes all the way out from BC. Go ahead, Billy.
Hello, my name is Billy. I'm 76 years old. I live in Coquitlam, British Columbia. And I'm curious about how I go about getting medical cannabis for arthritic pain in my knees.
Omar.
Hi, typically that would be for osteoarthritis. Most people have that when they get older, and that's a wearing down of the joints. CBD is very effective for relieving some of the inflammation associated with osteoarthritis and the pain, and does not have some of the side effects associated with THC. So I would try oral CBD. We have capsules available, optican.ca, that are very effective. The other product that you could try, and again, be very careful about the products you choose, not all of them are very effective. Topical CBD in the right formulation that has actual dermal penetration can be effective in treating local pain. And you can try some of that if you want to be careful about drug interactions or side effects associated with orally ingested or inhaled cannabis. And we have a product for that available as well called CB4 Relief, and you can check that out on optican.ca.
The next one comes from Christine. Here's what she writes. I take a cannabis cookie I make myself to help me sleep, and it works well. My mouth gets so dry, though, and I'm worried about my teeth and may have to stop. Any thoughts on this one? Dr. Glazer.
The dry mouth can be a side effect of cannabis, no doubt about that. And that when someone has those types of conditions, it can lead to poor dental hygiene, dental caries. One could very easily try to change the preparation and see if those side effects persist. I would change the preparation or the mode of delivery.
Omar, do you have anything that helps with dry mouth that she could substitute with?
Well, I think most of the dry mouth is associated with THC, to be honest, more than anything else. So limiting the THC exposure may help, especially if you're using a combination product and trying to go something with a higher CBD and lower THC dose.
All right, the next question from Scott. Go ahead.
Hello, my name is Scott. I'm from Burlington, Ontario, and I'm in my early 60s. My question is cannabis being used to treat Parkinson's disease? And what research is happening to demonstrate how it can help?
Dr. Glazer.
So, excellent question. Research has been undertaken in this area. We do know from experimental models of Parkinson's disease that there is increased activity of the endocannabinoid system within the basal ganglia, which is that area that is affected by Parkinson's. And we do know that cannabinoids are actually neuroprotective. In 2021, there was a very large-scale meta-analysis involving, I believe, 5 randomized controlled trials and I think 18 non-randomized controlled trials looking at the role of cannabinoid medicine in Parkinson's. And the data did not substantiate the treatment of actual Parkinson's with cannabinoid medicine. That's 2021. That's a very large scale meta-analysis. Nonetheless, what they did find was there are some potential benefits of the use of cannabinoids in other aspects of Parkinson's. Number one, sleep. So many patients with Parkinsons have sleep disorders, and their sleep is not restorative at all. So there may be a role in that. Many patients, which I think I alluded to earlier, have chronic pain syndromes or painful spasms, which I have found in my practice to be helpful. So chronic pain syndromes. In addition, anxiety. Many patients with Parkinson's, and it's understandable, are quite anxious, and there may be a role for being very helpful from that point of view. They've also found that the overall quality of life has improved with cannabinoid medicine. So there are some beneficial effects. I might add, though, that you have to be careful because there can be interactions with cannabis and Parkinsonian drugs. So that's the only caveat that I would say.
Joan has the next question, comes via email. Here's what she writes. How long after commencing to ingest CBD oil until one should notice the pain-reducing benefits for osteoarthritis in hands, knees, feet? Omar.
So one of the problems with oral CBD is that unless you take it with food and a substantial meal, that not much is absorbed. So only about 8 or 10%. So one thing you can do is try and take CBD oil with food to increase the effect and decrease the time to onset of CBD for anti-inflammatory pain effects and osteoarthritis. And if you do that, it should start working within the first 1 or 2 days with oral CBD. If you take our Optican.ca products, you don't need to take it with food because we have technology in there to increase the absorption regardless of whether you're taking an empty stomach or not. And consistent dosing in terms of time of day also helps get a consistent effect.
All right, stick around. There's more after the break. Welcome back to theZoomer. With just a few minutes left, we have time for a couple more questions from viewers regarding cannabis. Thank you for sending in these questions, by the way. The next from Cynthia, she writes, is it safe to use CBD in conjunction with antidepressants, SSRIs? Omar, let me start with you on that one.
Yeah, generally speaking, CBD is safe with many classes of drugs, including SSRIs. The one caution, though, is that CBD does inhibit liver metabolism of many other drugs. And you should be careful when taking it along with some SSRIs that are metabolized the same way. You may have some side effects associated with that. Check with your physician or your pharmacist regarding that, and they should be able to help.
All right, the next question from Richard. He writes via email, and Dr. Glazer, I know you're a specialist in obesity, so I'll go to you on this. Here's what he writes. What's the role of cannabis in obesity? Go ahead.
So interesting enough, when we looked at sort of population-based studies and we looked at weight, this was a couple of years ago, they actually saw that cannabis users' weight was a little bit less compared to their age-matched population. So THC has a direct effect with respect to appetite. It's this appetite stimulator. And the reason being, as I said earlier, it does act on the limbic system of your brain. And what is the limbic system? The limbic system is the pleasure system. It's the reward. It's the wanting. It's the needing part. And so by stimulating those areas, you have increased cravings, and that can lead to increased weight. And lastly, and I think this is actually even more interesting and exciting, is why is it that CBD does not affect your appetite? And one of the possible reasons is the way the CBD works, that within the hypothalamus, which is also an area within the brain that controls our appetite, that there are certain receptors, and that CBD actually stimulates those receptors that actually lead to either no increased appetite or a decreased appetite. So once again, it goes to the credence of understanding the physiology and the mechanisms of action with cannabis.
All right, that's interesting. And the last from Victoria, here's what she writes. How effective is CBD oil taken under the tongue for bursitis? What dose for a 200-pound person? Omar.
Okay, well, CBD oil taken under the tongue would actually help improve the bioavailability or absorption of the oil. And again, doses really come down to what's effective for decreasing the inflammation associated with bursitis. So it's very hard for me to tell you what is the right dose for a person, 200 pounds or depending on the actual condition itself and how acute it is. I would again start with a moderate dose of CBD taken under the tongue and increase it according to your physician or the cannabis clinic you're working with. We also at Optican have sublingual film strips that can taste good and are much more convenient than taking oil with you. And I would consider her to and other people to look at that as a potential alternative for sublingual or under the tongue administration.
Dr. Glazer, anything to add there?
You could use a topical right on the bursitis on the elbow. It may be very effective. You may not need to take it orally. The other sort of interesting thing is that we have a rough sort of guesstimate of for dosing of 0.25 times one's weight or a quarter of their weight may be the optimal dosing for a 200-pound individual. So that may actually be about 50 milligrams, just a rough guide.
All right. Before we go, quick final thoughts from both of you. Omar, I'll start with you.
Look, I think education is very important when people are treating themselves when it comes to cannabis and cannabinoid products. I really encourage people to do a lot of research ahead of time. And when they have questions, reach out to clinics such as Dr. Glazer's or reach out to optican.ca. We have a medical cannabis team as well available online. Do your research in terms of products, how well they work, how much data is behind them with regards to absorption and efficacy. Not all cannabis products, especially oral or topical, are created equal. And it behooves you to take some time to make sure you're taking.
Dr. Glazer.
Well, first of all, I'd like to thank you and people behind the scenes for bringing this topic forward. I mean, this is the way we decrease stigmatization by bringing a topic that's difficult to talk about, has its own taboo. So thank you very much to the organizers for that. I know Omar and I, have talked about that prior to the show as well. So I think that that's the first point. The second point is that it's very important. We do have options for treating many conditions with medical cannabis. And I would encourage both the individual as well as the healthcare professional to have an open mind and not limit your options in trying to improve quality of life. At the end of the day, we're all here to improve health and quality of life. And I think that it's an option that we really need to exercise.
All right, that's it for time. Dr. Glazer and Omar, it's great to see you both again. And to those of you at home watching, thanks for tuning in. We'll see you soon. For now, it's time to zoom out.